My name is Theresa. I am a clinical pharmacist at Barnes-Jewish Hospital, Washington University in St. Louis, Missouri. I care for two different ICUs, two neuro ICUs. One is a 20-bed neuro ICU and a newer 24-bed ICU where we take care of acutely brain injured patients. My role in the Curing Coma campaign is as a co-chair for the engagement committee. All individuals are welcome to join the Curing Coma campaign. We're really needing every discipline of the healthcare industry. We need physicians, nurses, pharmacists, researchers. We need people who are taking care of the patient in the acute setting. We need people who are taking care of acute brain injury in the rehab and outpatient setting. So not just pharmacists, but really every person. We're also very much so trying to engage the public as well. So not only those that have been affected by coma or brain injury, but the families as well. So we really all are invited to be a part of this awesome campaign. And we need everybody to fully understand the spectrum of coma across time, and everyone's engagement is really going to help us get to that end goal. Curing coma really means giving our patients and our patients' family a sense of hope, really, that coma is treatable and recoverable, something that we really don't have just right now. I do think that the Curing Coma campaign provides that necessary infrastructure that coma is, or to facilitate really the research that is fundamental in understanding and treating coma in patients. I also think it's a great platform to promote education and provide resources to both, as I mentioned earlier, the public and healthcare professionals. I think it comes down to one word, and that's hope. I think right now where we struggle with understanding the trajectory of many of these patients and how to prognosticate and how to approach families when their loved ones are in crisis. And I really think that this campaign, I hope that it offers hope to all of us, from those taking care of the patients to the families that are having to live through this. And I really think it starts with understanding the patient population and really understanding the kinetics. So we really have to go to the basics here, understanding how drugs behave differently in patients who are in coma and in various states of coma, as well as we think that metabolism probably can change. And so the amount of drug or the side effects or things that we have no idea about really need to be studied. So it's really getting back to the basics, really understanding the patient population, and then moving forward, understanding the drugs in those groups and researching it. I think I want to encourage everyone, from the public to those that have sustained or been a part of being in that realm of having a head injury or having a family or a loved one that has had these, including pharmacists, nurses, anyone who, and to be honest with you, I think a lot of times we think neuro ICU, acute brain injury, those are the people that we're really targeting, but not really. There are people in comas in the medicine ICU. There are people in comas in nursing homes. There are people in comas across the gamut. And so all need to be involved. And I think that's really my message, and my hope is that we can get everyone to help. And we need the primary researchers at the benchmarks, and then we need clinicians, and then we need the public really to understand and to get the word out that coma is recoverable.